Hi, I'm Justin Engelmann. I'm a postdoc at the UCL Institute of Ophthalmology in the group of Piers Keen, and I'm also an honorary researcher at Moorfields Eye Hospital. And I work on AI and advanced algorithms to automatically interpret images of the eye. So, for instance, we can take images of the back of people's eyes, of the retina, and I've developed algorithms that help quantify how healthy the blood vessels are in the eye, or look at other sort of layers related to vision, as well as automatically detect and quantify things related to eye disease. Not all images that we take of someone's eye are of perfect quality. Like, for instance, sometimes the illumination of the image is not good or it's blurry. And you can imagine then if we're looking for instance, very fine vasculature, if the image is blurry, we can't really see the blood vessels properly, so we can't analyze these images. And in research studies, often people discard maybe a quarter to half of the images that have been collected because they are not of sufficient quality to be analyzed. And that is quite wasteful because we lose a lot of data. But then you can imagine if we develop algorithms that only work on half of the data that we collect for a research study, they're not going to work well in practice either. So in clinical practice, image quality is an even larger problem. And if we develop algorithms that don't work half of the time, then we really are developing algorithms that don't work at all. So part of my work is focused on trying to address that through more robust algorithms for analysis, but also by having algorithms that basically within a fraction of a second can tell you whether the image that was just taken is of good quality. And what I imagine is like when we collect data in future studies, we could run that in real time. Someone takes an image and they get immediate feedback whether the image is of sufficient quality. And if it isn't, maybe they can give it another go or two before the person, sort of like the research participant, goes home. And hopefully we end up with more analyzable images that way. So foundation models are a big trend in medical image analysis. And in our group, we've developed a model called RedFound, which was published by some colleagues of mine in Nature recently. And that's a model that has seen a lot of retinal images and then can be adapted by other researchers for various disease and systemic disease prediction tasks. So it's quite a useful tool for researchers. And but one challenge with these models is that they can be quite computationally intensive first to train, but then also they're relatively difficult to use, as in you would need to run them ideally on a server if you wanted to process a large number of images. And one thing that I was wondering is like, can we make that more efficient? For instance, I have some collaborators in Uganda, and they have issues with access to sufficient compute and sort of like power outages and so on. So one question that I've had for my own work is, would it be possible to have a lightweight version of a retinal foundation model that we could run on a regular smartphone? And this is like what I've been working on. It's called RedFound Mobile, and it's something that like I can on my phone I can process an image in about a second, and sort of the foundation model will then give you a detailed descriptor of what's going on in the image, and you can convert that into a prediction for various outcomes. And all of that just runs directly on a phone, no servers involved. And you can imagine if it runs on a phone in a second, you could probably run it on your laptop quite a bit faster. So it's also hopefully going to inspire people to realize that not everything related to AI needs a massive data center, and some of these things actually can be used like sort of quite easily and quite widely.